very important to understand in dental sleep medicine that price is only an objection in the absence of value. I'm going to say that again. Price is only an objection in the absence of value. If a patient declines treatment on the basis of cost, whether that's the cost of their deductible, whether that's your cash price, it is usually because they've not received enough perceived value in order to feel the pain of writing a check for that amount of money. Paying that much money outweighs the pain of not doing something about their obstructive sleep apnea. Your mission is to deliver enough value. Maybe you're highlighting that through an emotional connection of the pain they're experiencing in other areas of their life due to not following the treatment modalities they were prescribed. Or you can do it by creating urgency, future casting, telling people, imagine your life like this. If you don't do this, here's X, Y, and Z that could possibly happen. Connect emotionally to the pain that their condition is causing them. And if you can do those things, you're going to see far less people saying no to treatment and willing to write the check for that deductible, for that cash price for your appliance, because you have delivered value, and that value outweighs the cost of not doing anything.